In this Kirkland Business Park, a telehealth pharmacy that manufactured diet drugs had a problem. In its small production facility, Equita grew quickly, but had a hard time holding on to employees. This man, operations manager James Lindsay, had a solution to the manpower shortage, according to whistleblowers who filed complaints with the Washington State Department of Health. Equita produced versions of the hottest drugs on the market, GLP-1 weight loss compounds. Pharmacists manufactured the products in this sterile glass enclosure at the Kirkland facility called a clean room. When the company needed more workers to process the thousands of medicine kits it shipped each day across the U.S., it didn't turn to LinkedIn or networking sites to find employees with the right credentials. Instead, Lindsay found workers like these men by hitting the parking lots of home improvement stores, according to 6 former Equita employees interviewed by the King 5 investigators. Were they really going to Home Depot and Lowe's parking lots and scooping up employees?
They would come over to our main facility, our main pharmacy, and actually handle the pharmaceuticals themselves when we were short-staffed and they didn't have any state licensing.
What did you think of that?
That I did not like, and I did not agree with it.
For 4 months last year, Paul Myers ordered supplies and received deliveries as Equita's lab manager. Myers is the only one of the 6 former employees we spoke with willing to appear on camera. Video from inside Equita documents a string of violations at the licensed facility. A day laborer opens a refrigerator. It's stocked with GLP-1 medications and patient names. Access is restricted by law to licensed staff only. But the temporary employee sorts through tubs of medicine. Operations manager James Lindsay walks by, apparently unconcerned that an untrained stranger has access. In other videos, you can see groups of day laborers packing medicine and labeling boxes for shipment, also work that is supposed to be handled by licensed pharmacy assistants.
They were there pretty much all the time. Most days that I was there, they were there.
Federal regulations require that cameras monitor pharmaceutical operations. Whistleblowers gave these images from inside Equita to State Health Department investigators last year. The source that provided them to King 5 did not want to be identified.
There was definitely a big push for maximizing output of shipments.
You're saying the emphasis was not on safety and quality control?
No.
The emphasis was on what?
Making money. 100% making money, and that was the primary focus.
We had many questions for Equita's owners. I'm just trying to figure out what's going on.
I can't speak about it, sorry.
We took those questions to Equita's Kirkland facility earlier this month, where a man who identified himself as Dante answered the door. I'm hoping somebody from the company will talk to me and explain it.
Okay, that sounds good. Well, okay. I will let my manager know, okay. And I suppose he'll probably reach out.
She didn't. She is the CEO of San Francisco-based Mochi Health, which owns and operates Equita. Myra Ahmad, a University of Washington Medical School dropout, founded the telehealth startup in 2022.
By starting this company and by helping people sustainably lose weight all across the nation, you would be able to touch millions of lives.
Sold under the Mochi name, the company's products use the same active weight loss ingredients as name brands like Ozempic, Mounjaro, and Zepbound.
This is Mochi's new all-in pricing.
But Mochi is much cheaper. Why? Records from the Department of Health say Mochi took alarming shortcuts. Whistleblowers filed complaints in late 2024, and DOH launched an investigation. One pharmacist at the Kirkland facility said managers pushed him to verify prescriptions as fast as you can and base salaries on output. With only a second or two to examine each medicine vial, it was very difficult to maintain quality. Mochi customers posted photos of specks of contamination in their vials, the very thing pharmacists are supposed to flag.
Very frequently, the pharmacists complained about debris being in the vials.
A whistleblower shared this photo, a bin of medicine kits returned by customers who could see something was wrong with the medication the pharmacy sent.
Because they were packaging pharmaceuticals before they knew if they were good or not. That is a major, major violation to me.
Whistleblowers called one controversy Glassgate. Equita bought medicine vials from Alibaba, a website selling glassware cheaper than medical supply companies. But the vials were breaking and shattering in the pharmacy and in transit to customers. Here's another problem that sounds silly, but is serious for a medicine that must be shipped cold. Equita managers had employees wrap drugs in frozen Otter Pops, a popsicle treat for children, instead of medical-grade ice packs. That stopped when there were tons of complaints and negative online posts from patients.
I was so sick that I thought I was dying.
Some patients claim Mochi medicine made them sick.
And I've been throwing up in our bucket here.
Sean Rose of Chicago put his experience on TikTok after he said an injection of Mochi GLP-1 made him violently ill. How many times did you end up going to the hospital?
4 times in total. Admitted twice, released through the ER twice. At one point, they told me if I wouldn't have came in, if I wouldn't have came in when I did, I would have probably died.
Sean Rose says his Mochi medicine came from an Illinois pharmacy, not Kirkland, and the state of Illinois is investigating. This is Dante, right here. Come on over here, Dante. We need to talk to you. We returned to Mochi's Kirkland operation when our calls and emails did not get a response. Can you put us in touch with somebody? Dante, can you put us in touch with somebody? I don't think he's going to help us. Afterwards, Myra Ahmad, the Mochi founder, sent this email, forwarding to our team who can chat with you. We haven't heard from the team. Do you regret working for that company?
I do, yeah. I have had regret working there because my effort there potentially could have hurt people, and that's not what I want to do.
Now again, Paul Myers only worked for Equita for 4 months last year. Before health department investigators came in and issued what's called an emergency stop service on the company's license. That was lifted after Mochi fixed 24 violations. A year later, Mochi remains in business, although sources told us they don't think that the diet drugs are being made at that Kirkland compounding pharmacy anymore. The State Department of Health won't answer any questions, citing an ongoing investigation here.
A lot of people use these types of drugs. So what do they need to know to stay safe?
Yeah, so the brand names are the ones that are really approved by the Food and Drug Administration, and those are safer, but they're also more expensive. Experts say you should stay away from any telehealth that doesn't require a prescription, has no patient support, or is unlicensed. Unfortunately, a lot of people are choosing based on what they can afford, and some shady companies are taking advantage of that.
If those whistleblowers hadn't come forward.
I'm very appreciative of that, man. You bet.
More stories to come.
Yep.
Thanks, Chris.
Mm-hmm.